Does your daughter refuse to wear dresses and likes throwing a football instead? Or does your son have an interest in girls' clothes or cosmetics? If you answered yes, then chances are your child has gender identity disorder, or gender dysphoria. Gender identity disorder, also known as GID, is a condition in which your child feels a strong identification with the opposite sex. Gender identity disorder is a rare condition that, as you may probably tell, can be evident in early childhood. Most children recognize they have a gender identity problem before they reach adolescence. Gender dysphoria will affect your child's self-image. Because your child feels that they do not fit in with their biological gender, this can impact and change their mannerisms, behaviors, and clothing choices. Now that you know more about gender dysphoria, you may begin to wonder what made your child different. Well, the exact cause of this disorder is not known. However, there are several theories that exist. These theories suggest that the disorder may be caused by genetic abnormalities, imbalance of hormones during early development, and defects in normal human bonding. Having gender identity disorder is not fatal. However, you may have noticed that your child has shown signs of depression and withdrawal due to a great deal of confusion. You may have begun to ask yourself questions like, is what my child doing normal? Should I be trying to change him or her? The answer to all these questions is 100% no. When seeing your child in this distressed state, what you need to do is talk to your child and let them know that it's okay for them to express his or her gender identity freely. If you do not talk to your child, he or she may become more confused and feel alone in this situation. This can cause a poor self-image, social isolation, and emotional distress. Untreated, the disorder can also cause severe depression and anxiety and can interfere with an individual's ability to function, leading to problems in school or work or with developing relationships. Obviously, by watching this video does not mean you are now entitled to diagnose your child. Gender identity disorder within children should be diagnosed by a trained mental health professional, like a psychiatrist or a psychologist. A thorough medical history and psychological exam are performed to make sure that your child's symptoms could be the cause of something else, such as anxiety. Gender dysphoria is diagnosed when the evaluation confirms the persistent desire to be the opposite sex. Children with gender identity disorder often feel great discomfort regarding his or her actual gender. Some symptoms your child may have include an expressed desire to be the opposite sex. For example, your child may begin to call themselves by an opposite sex name. Disgust with their own genitals. For example, a boy may pretend that he does not have a penis, or a girl may fear growing breasts when she hits puberty. And dressing and behaving in a typical manner of the opposite sex. There is no cure for gender identity disorder. This happens to be a psychological trigger in your child's brain that is telling them that something isn't right with their body. Your child may feel ugly in their body, which results in depression, anxiety, and self-esteem issues. While there is no cure, individual and family counseling is recommended for your child to help them deal with the associated problems of depression and anxiety and low self-esteem. Chances are your child may express a desire to alter their body. This can be done through hormone blockers, which will treat your child's disgust with their own genitals as the drug stops the development of sexual characteristics of the gender they were born with. There is also such thing as the surgical alteration of a person's sex, which is sometimes referred to as a sex change. However, offering this treatment to kids younger than 18 raises ethical concerns and is not recommended by mental health professionals. What you need to understand is that it's important to be supportive of your child. What they need to know is that it's okay for them to have typical interests, behaviors, and desires of the opposite sex. As a parent, it should be your responsibility to provide a supportive home life, a school with anti-bullying protocols, and therapy for any harassment they face for being different.